Why are some countries now struggling in the fight against HIV/AIDS while others are finding success? And why are rates of new HIV infections not falling as quickly as they once were? I talked about that with Dr. William Schaffner. He's a professor and chair of preventive medicine at Vanderbilt University Medical Center.
Well, what's happening in this world report card that we've received is that there are many places in the world where cases are continuing to occur. You know, the report card gave us some A's, B's, and C's, and clearly new cases keep being generated despite our best efforts, which tells us we need to do more things better.
And those things might be what?
Well, everything from education to acceptance, to the distribution of condoms, for example, to the provision of good treatment, because if a patient is well treated, it's much less likely that they'll be able to transmit the infection to others, to making sure that mothers get treated so they don't pass the infection on to their babies. There's now something called PrEP, pre-exposure prophylaxis, which means we can now give medication to people before they become ill. And of course, such things as needle exchange programs. I know they're still controversial, but that beats me as a public health person because there are now many, many studies to show that they do not encourage drug use, but they surely do prevent the occurrence of HIV infection, hepatitis C, and other such illnesses.
You mentioned treatment, and to treat HIV, doctors use a class of drugs called antiretroviral therapy, or ART. The drugs have prolonged lives, they've reduced the HIV mortality rate, but that also means more people are living with HIV. So how does that change the dynamic of treatment?
First of all, we need to reach the 60% of people around the world who have HIV who are not being treated. But now that we have more and more people under care, we need a network of doctors and clinics and nurses who can maintain those individuals under care, and as they age, to make sure that they get age-related complications and that they continue to maintain their antiretroviral therapy. It's success. It's like treating diabetes very well, so we have very many more people with diabetes under treatment, and they're getting older.
It's like a chronic illness in a sense. So how do these drugs actually work?
What the drugs do is they can't eliminate the HIV virus in our bodies, but they can inhibit its multiplication. So in effect, it puts the virus into hibernation. It just freezes the virus. It doesn't do any more damage, and it lets the body recuperate and regenerate its immune system.
So what's a day like for a patient these days compared to the early days, the early onset of the disease?
Oh, compared to the early onset of disease back in the old days when we had to give many medications with many, many side effects, it was very, very difficult. Today, the treatment regimens are much simpler and there have many, many fewer side effects, so we can manage that very well. And the patients who can maintain their treatment, they don't get the complicating infections, and it was often the complicating infections that led to their hospitalizations and their dying.
Medical experts usually say that a cure usually comes down to funding. The more likely it is a cure will be found. So consider the fact that global funding for HIV research is actually dropping. How will that impact research, and how close are we to a cure?
Well, we need more research both to cure and to prevent. We're working on HIV vaccines. That would be wonderful because then we could prevent the initial infection entirely. We need more money for research because treatments need to get even better than they currently are. And we also need more money to maintain patients in care and to reach out to those people with infection who still are not being treated. And there are many, many of them around the world.